happened to fall at work and landed on my coccyx, and I have nerve damage between the discs. So the left side is quite numb and the right side is starting to bother the same way. And with that comes a lot of pain.
Pain was like nothing else I had ever experienced. I used to pace the floor in the middle of the night and it was like somebody was taking a knife and stabbing my arm.
I have chronic pain because I had a tumour that was found on my spine, twisted around my spinal cord, which resulted in numerous operations. My spine eventually collapsed. Then I had to be straightened again, which just all the operations and all the stress on my spine has left me with pain.
I had a 1-year-old daughter at the time and I couldn't lift her. I couldn't get up with her through the night. My whole life totally changed, and so my whole family's life changed after I fell. And due to having the pain, I started to get severely depressed. And I had to have help with my daughter. My mum had to come over near enough every day to help me look after Chloe, which was hard to accept, the fact that I was independent and done it all myself and was enjoying having a 1-year-old child. And then the fact that I couldn't do things for her that a mum should be able to do was hard, very, very hard at the time.
I lost my job very early on in this because I got ill health retirement. So it's all about, there's a huge amount of loss involved. I lost my hobby because I couldn't sing and dance anymore. So everything was about loss. So, and there's a huge amount, I've never been an angry person and I suddenly became this really angry person. And I was really down, really depressed.
When my daughter was that age, I was a lot more unwell than I am now, so Sorry, I'm just going to count down a minute.
I think it's fair to say that an awful lot of people with chronic pain develop emotional problems over time. Probably 50% of them, I would think. They become depressed, they become anxious, they get panicky when they go out, they become socially isolated, they have difficulties within the home, within family functioning, inability to fulfill their normal social roles, if you like.
Most of the time I sort of spent in the bedroom or on the couch, and my daughter was sort of brought into the bedroom with me to spend time with me. Or we would go out, you know, with me in the wheelchair and she would run around and play. Sort of stopped me from being the parent that I wanted to be at that time. It made me quite jealous when I'd see other parents out pushing the buggies and prams and was unable to do that because the pain was completely debilitating at that time.
My son still wanted his mum. You know, he didn't want his mum to be this person who was falling on the floor and couldn't get up off the floor. And, you know, so I became a person that I didn't know anymore. I was lost. I was completely lost. And I became isolated really very quickly early on because they were putting me on medication that made me drowsy, sluggish. I wasn't able to drive. I was stuck in the house here.
When people have pain, they naturally cut back on a lot of activities. So there's the losses involved with cutting back. So they maybe don't see friends as much. They're maybe not doing as many things that were important to them previously. But I think also just not having that degree of social contact, not having that degree of involvement, causes people to develop emotional problems. People lose their confidence in social situations.
People didn't know how to take me, so people didn't visit, or if they did visit, they didn't understand who this person was that I had become, because I was cranky, I was bad-tempered, or I just sat and stared into space because of the medication. So I became really socially isolated very, very quickly, very early on.
If somebody has an emotional problem to begin with, when they have an accident, for example, or they hurt their back, or whatever starts their pain problem, I think it makes it more likely that the course of that problem is going to be protracted. Even if somebody didn't have an emotional problem to start with, I think emotions start to play a part in the exacerbation and maintenance of a pain problem. There's a direct link between feeling anxious and feeling depressed and pain, so that I have lots of my patients that tell me that when they're feeling stressed, their pain is a lot worse.
We often find people have pain for which there is no disease, if you like, that we can cut out or treat or make go away. And for some people, that can be very difficult for the healthcare professional to admit that, and it's often very difficult for the person to hear that, because all the messages they're getting is that there's some horrendous disease going on. Pain is a danger signal. And then unless we find something, perhaps people perceive that their symptoms aren't being validated, and it may be that they think their healthcare professional thinks they might be fabricating it, malingering it, or all these sort of other negative associations.
He thought I was actually imagining it. He thought I was actually pretending. That's the way he looked at it. And I came out one day and I just cried because of the way he didn't understand.
People turn around and say that, the doctors turned around to me and said, it's all in your head. And I don't think doctors do turn around and say it's all in your head, but I think that's often what people hear. And so it becomes really, really complex.
I wanted to hit him, to tell you the truth, because he just did not listen to me. He just told me to keep taking ibuprofen and cocodamol, and I ended up near enough overdosing because I had to take extra to keep the pain not at bay, but at least a little bit better to help me cope with life and day-to-day things that I wanted to do. And I was taking like 12 ibuprofen and 12 cocodamol at the same time. Well, in a day, rather. And he never flagged up the fact that I was getting repeat prescription after repeat prescription. The chemist commented on it one day, and she told me to go back and see him again. But when I went back, he actually told me to go back to work. He signed me off the sick and go back to work. I'll be a lot better when I go back to work and start moving about again.
People begin to think that they're not being heard or understood, and I think it ultimately can easily slide into a very dysfunctional relationship and a dysfunctional experience, and frustration and anger with the healthcare system that they can't be fixed.
He never listened to a word I said. He did not understand what I was going through.
I think it's quite plausible to suggest that sometimes people would see depression and anxiety as a natural consequence of having pain and all the limitations that come with that. That can then prove to be a barrier to getting those emotional problems helped and treated, because people might, health professionals might say that this is not going to improve until the underlying pain problem is resolved, and I think that isn't the case. We certainly find that people coming through these programs where we're not helping their pain necessarily, these kind of approaches do help emotional problems significantly.
I'd started to be attached to the pain clinic, so it was very fragmented, so I was getting sort of acute service. I was being treated as acute patient, but I'd started to still be under the pain clinic, but because of the waiting lists. So during that time they told me to read the book Explain Pain, and I think every patient should read that book time and time again. I actually think every patient should be given that book. The visual description of pain, all these contorted figures describing how pain is, that's how my pain is. And I thought, here's somebody that's understanding. It's explaining to me why my pain is, why I have so many strange odd pains, why it's gone to different parts of my body. But that's okay. I can understand that, because if you don't understand pain, it creates fear. And when you have fear, it creates all these other huge negative emotions, all the chemicals it releases in the body, which actually makes your pain worse.
A big thing for me personally was to learn about my pain. I've read some books now about what pain is, and that seems to help massively. You have so many doctors that are, you know, saying different things to you, and sometimes you're not really understanding what they mean when you say, oh, your back's firing off signals or whatever, and you think, what does that mean? Whereas now I feel like I understand what that means. I understand how pain has occurred. So when I get pain, it's not so scary anymore. I feel like I can understand it. I know how to move past it and sort of deal with it now.